Good afternoon and welcome. Let's take a look at our top story this hour. The National Task Force for COVID-19, constituted by the Indian Council of Medical Research, has approved the use of anti-malarial drug for high-risk population. The Indian Medical Research Council recommends the combination to be administered to asymptomatic healthcare workers involved in the care of suspected or confirmed cases of COVID-19 and to those asymptomatic household contacts of lab-confirmed cases. The medical body strongly advises that the intake of this medicine should not instill any sense of false security. Now, we are being joined by Siddhant Sibal, WION's principal diplomatic correspondent. For more on this, good afternoon to you, Siddhant. What does this mean, this anti-malarial drug to be used in asymptomatic cases? Take us through the statement.
Well, there is a lot of controversy regarding the use of this, but now the Indian authorities have allowed, the Icmr has allowed, saying that the eligible individual, they have given how the dosage should be used. The eligible individuals can be asymptomatic healthcare workers involved in the care of suspected or confirmed cases of COVID, or also asymptomatic household contacts of the lab confirmed cases. We know that the US President has also talked about it, but the scientific community in general, there is no consensus. They say that still they need to get evidence regarding it, but it is a case of something better than nothing given the current situation. In a short while from now, the Indian government will doing its daily briefing. I am there in the press room where the briefing is going to start, and we do expect more details to emerge regarding the use of this medicine.
Siddhant, they say that it must not instill a sense of false security. What kind of outcomes are they hoping to achieve with this drug?
Well, yes, you are very right, because the scientists have advised caution. They have said that the research currently emerging is that there is not confirmed proof, but there have been cases as well that it can help thwart any cases of the virus. But by and large, abundant caution is something that can be said about it by the scientific community. But the fact that the Indian government has talked about it, has said that it can be used, shows that there is some kind of hope also regarding this use of the medicine. Also, they have given certain kind of exclusions, that drug is not recommended for children under 15 years. The fact that the drug has to be given only on the prescription of medical practitioners. Also, the Indian government has said that it is advised to consult with physician for any advice, any adverse event or potential drug overreaction. So these are the measures the government has said, but by and large, we do expect more details to emerge after the press conference by the Indian government.
Great. Thank you, Siddhant, for that report. And you will, of course, be keeping us up to date. That is WION's principal diplomatic correspondent, Siddhant Sibal, for the latest on the statement by the ICMR.